On this slide, I wanted to talk about labor and delivery. Labor is defined as regular painful contractions resulting in cervical change, whether that's dilation or effacement. The first stage of labor is when you're between 0 and 10 centimeters dilated. Early labor is less than 6 centimeters, and in this phase, contractions tend to be more irregular. In active labor between 6 and 10 centimeters, contractions typically become more regular and more painful. Patients are more likely to request an epidural during this phase of labor, and the water is more likely to break spontaneously. The second stage of labor is from the time you're fully dilated or 10 centimeters until delivery of the baby. And this is the stage where you'll be pushing. Pushing can take anywhere from a few minutes to a few hours, and we consider it normal for a first-time mom who has an epidural to push for up to 3 hours. The third stage of labor is from the time the baby's out until the time the placenta is delivered. The average duration of this stage is about 5 to 6 minutes. However, if 30 minutes have gone by and the placenta is not ready to come out, your doctor may recommend manual delivery of the placenta. What to expect on labor and delivery? One is you won't be alone. You'll have your support team with you, advocating for you, and your medical team there to support and answer all of your questions. So most patients will come with a partner or a close family member or friend. Some patients will opt to have a doula as well, and you'll have your nurse and your doctor. In terms of common interventions, I recommend all of my patients have an IV in place during labor. And this is so that we're prepared in case of something unexpected like an emergency. An IV will also allow you to get antibiotics if indicated for group B strep. It's necessary if you were to need Pitocin for augmentation, and also to give you fluids before placement of an epidural if you desire. Another thing to expect is fetal monitors. Specifically during the active phase of labor, we're going to want to monitor the baby. We have an external ultrasound monitor to monitor the baby's heart rate, as well as a contraction monitor to monitor the frequency of the contractions. Most labor floors now have wireless monitors available as well, which is really nice for patients who are trying to move around a lot. I also want to touch on this slide about labor augmentation. So as you can imagine, dilation does not always follow an expected curve during labor, and sometimes it can stall out. If that were to happen, your doctor may offer you breaking the water or starting a medication called Pitocin. Pitocin is a medication that acts like the hormone in our body called oxytocin. This will make the contraction stronger and more frequent. I want you to know that every labor experience is unique, and I recommend being patient with yourself and asking your questions along the way.